I will start by apologizing. The lecture where I had my introduction, we are going to consider that one as lecture number 1. So this one is now lecture number 2. Sorry, I didn't mention that in my introduction. So just know where you hear my name being mentioned and my introduction, that is lecture number 1. So this is lecture number 2. And on lecture number 2 now we are resuming from where we stopped in lecture number 1, and we had stopped on decentralization, whereby decentralization is among the principles of what of PHC. So here in decentralization, here we think after the Alma Ata conference, a sixth theme emerged, that of decentralization, reflecting the two key principles of community participation and multi-sectoral decentralization away from the national or central level brings decision making closer to the communities served and to field level providers of services, making it more appropriate. There is also a greater potential for multi-sectoral collaboration at the lower service delivery level. Decentralization may enhance the ability to tap new sources for financing healthcare. Finally, by breaking down the large monolithic decision-making structures typical many national ministries, decentralization may lead to greater efficiency in service provision. However, decentralization may lead to geographical inequalities in resource availability and technical quality. If handled inappropriately, decentralization may result in a shift away from the principles of PHC. Planners should therefore consider whether specific strategies and decisions will enhance or hinder the achievement of PHC. So here under decentralization, I will start by breaking the term decentralization. This is where the services are brought from the national level and transferred to the district level, maybe from the national level to the region to the district to the sub-county level, sub-county to the parish, till to the village level. And here now we are saying this can lead to promotion in what? In health services, by making sure that all people access services at all levels of the country, at all stages of the project. However, if it's not done efficiently, if it's not done well, it can also lead to what? To imbalance of resources of health resources in the country or in the communities. Have now activity 1. And activity 1, remember we've already tackled what primary health care is. So this is your activity. Activity number 1, define the term primary health care. Activity number 2, explain different principles of primary health care, giving the element where appropriate. Then we go to the next subheading called the core activities for PHC. There is a set of core activities which were normally defined nationally or locally. According to the 1978 Declaration of Alma Ata, proposed that these activities should include, and actually I would urge everyone, you can download that, the Alma Ata, that declaration, the conference. Remember when I was introducing decentralization, above there is that heading of what? Alma Ata conference of 1978. You can download that and read so that you get to know more about Alma Ata declaration. What was it all about? So we are saying one of the core activities that we actually mentioned in the Alma Ata conference of 1978 is as follow, and include the following. Number 1, education concerning prevailing health problems and the methods of preventing and controlling them. That is self-explanatory. The number 1 core activity in the Alma Ata Declaration of 1978, it was you educate the community concerning the prevailing what? Health problems. So that these community members, they are aware of the problems that they face in the health sector, in the health field, and the methods of preventing and controlling those problems. You educate them so that they are aware of the challenge, and at the same time you give them the remedy, the control, the prevention. How can they prevent the challenges that are being faced? Number 2, core number 2, promotion of food supply and proper nutrition. Here we are aiming at giving people food which is nutritious. Encouraging the community members to eat on a balanced diet on a daily basis, and we're supplying them with nutritious foods. Number 3, an adequate supply of safe water and basic sanitation. Here the declaration was all about supplying safe, clean water to people. Here you have piped water, boreholes, and making sure people stay in a clean environment. Number 4, maternal and child health care, including family planning. Here, first of all, the declaration focused about how is mother to child. We should make sure that the child and the mother, they are in good health during pregnancy and after pregnancy, what we call the natal, prenatal, and postnatal. Before pregnancy, during pregnancy, and after pregnancy. That's what it means. And we guide them in what? In family planning. You don't just produce for the community. Produce what is what? The number which is manageable. And you teach them on the available family planning what? Services and how they are supposed to be applied in life. Immunization against the major infectious diseases. Talk of malaria, polio, and to mention but a few. Prevention and control of locally endemic diseases. Talk of like diseases like cholera, then talk of diarrhea, talk of such diseases. Just mention but a few. Appropriate treatment of common diseases and injuries. The treatment must be available and it should be appropriate. And the injuries must also be what? Treated as early as possible. Basic laboratory services and provision of essential drugs. The testing, people should go for checkups. They check up themselves so that they find out what their status are. And the drugs that are provided to them must be essential. And indeed, the drugs that are provided, the medicines that are provided, must address a particular problem. Training of health guides, health workers, and health assistants. Here I talk about health guides. The VHTs came in, the village health team trained them. Red Cross also came in to give a hand, to give a support in providing health assistance, doing voluntary work, and also educating, training the nurses, such professions that lie under health what? Services. Referral services. Here now referral services, we look at services like for mental health, physical handicaps. The mental health, they talk about people to go and to be checked by psychiatrists, more especially people who have mental retardation or people who are mentally disturbed, what we call intellectual impairment. Physical handicaps. These are people who are physically handicapped. You find someone has a disability, has a multiple disabilities. Someone is lame and at the same time someone is deaf. That is a physical handicap. You get? You have two disadvantages at the same time. You cannot see and you can't hear at the same time. That's what we call physical handicaps. So we refer such we refer such people, and we cannot refer them without their what? Their services set. We make sure that their services are in place where these people can go. They should have specified health centers where they can go and seek medication. That's why in Uganda we have where we can take people who are intellectually disturbed. For instance, you have the National Hospital Butabika, where we take people who are intellectually disturbed, people who are somehow mental ill, where they can seek assistance from our psychiatrists. Health and social care of the elderly. These organizations must be in place to make sure that the elderly are taken care of. The elderly's needs are met. The elderly's needs, they have someone who is in charge of them. That's why if you go into that side of YC, you realize there's a Uganda home for the elderly. It's where they go and seek for what? Seek for care. As you see, Uganda as a country, they are coming out with the program, at least to be providing, I don't know whether it's 20, 25, at least to be giving them back 25 every month. However much it's not enough, but at least it's there in what? In place. They can go and get that little money, and at least they buy some services. They get some services according to them or given to them. Now let's look at the WHO strategies of PHC. WHO here, the World Health Organization strategies of PHC. Strategy number 1, reducing excess mortality of poor marginalized populations. PHC must ensure access to health services for most disadvantaged populations and focus on interventions which will directly impact on the major causes of mortality. Morbidity and disability for those populations. Now here, the World Health Organization came out with the strategy of PHC of reducing what? The number of people that were dying, the number of deaths, and how was this being done? For instance, in the past, the poor people, what we call the marginalized communities, the marginalized groups, the disadvantaged groups, the vulnerable groups, they would die simply because they would not access health services. And now here, the WHO, the World Health Organization, came on board and said, no, we must intervene. We must intervene in the situations of our people, the vulnerable groups, the disabled people. We have to intervene and find out what is all causing this and how can this be dealt with. Number 2, reducing the leading risk factors to human health. PHC, through its preventive and health promotion roles, must address those non-risk factors which are the major determinants of health outcomes for local populations. Now PHC and its agents all over the country spread, they should be in position to reduce the leading risk factors to human health. They should find out, they should make a research, they should do data collection and find out where are these risks coming from and how can we deal with the risks? How can we exclude the risks that is reducing our population, that is killing people They should know the source, the root cause, and then they come out with the prevention. Number 3, developing sustainable health systems. PHC as a component of health systems must develop in ways which are financially sustainable, supported by political leaders, and supported by populations served. PHC has to come out with a sustainable health systems, and these systems should be supported by the people themselves, the political leaders, and supported by all the stakeholders, meaning that everyone is supposed to be part of the development. Strategy number 4, developing an enabling policy and institutional environment. PHC policy must be integrated with other policy domains and play its part in the pursuit of wider social, economic, environmental, and development policy. Now let's look at the basic requirements for sound PHC. The 8 A's and the 3 C's in bracket. Appropriateness, that is A number 1 now. Whether the service is needed at all in relation to essential human needs, priorities, and policies. The service has to be properly selected and carried out by trained personnel in the proper way. Here now they are saying the service has to be properly selected and carried out by what? A trained personnel in the proper way. We have to engage different experts to come on board and they select a service that is going to suit the needs of a certain community. A number 2, availability. Availability of medical care means that care can be obtained whenever people need it. Here now, the medical services, in simple terms, should be extended near to the people, to the community members, that whenever someone falls sick, there is a health center where they can go and access medication. Adequacy. The service proportionate to requirement. Sufficient volume of care to meet the need and demand of the community. Here the service must be in plenty, must be enough, must be there to make sure that it meets all the demands, the needs of the community. If you are supplying a certain drug, you make sure that it covers each and every person in the entire community. No one is supposed to be left behind. There is no segregating. accessibility, reachable, convenient services, geographic, economic, cultural accessibility. Is the service that you are bringing to the community accessible? Can it be reached by everyone in the community? Is it convenient? Does it have an impact on the economic activities? Is it culturally acceptable, or it's against other people's cultural norms? Affordability. The cost should be within the means and resources of the individual and the country. It should be within the capability and abilities of the country and the community members as well. It should not be something which is beyond the abilities and the capabilities, so that they cannot provide what? The service to themselves. They can't afford to get the service, and the service again is becoming more expensive. No, it should be affordable to them. Accessibility. Accessibility here means that medical care can be readily evaluated. If you make an evaluation, I come again, this is accessibility. Can it be assessed? Can you make an assessment and come out with an evaluation? And you have to make what? An assessment, and you come out with what call an evaluation. What you call monitoring and evaluation. On a daily basis, you do what you call monitoring. But the evaluation is done periodically. Maybe at the end of the month, you come up with the what? With an evaluation. What transferred the entire month? How was the service being done? How was the service being implemented? Was it effective? Was it meeting the people's needs in the community? Those are the questions to ask under the accessibility. Not like interchange these things, like or confuse them with accessibility. There is accessibility and accessibility. This accessibility, the other one is accessibility. Accountability. Accountability implies the visibility of regular review of financial records by certified public accountants. My dear, however much you are rendering a service to the community, but we must employ certain experts, different experts. That's why we always say such disciplines, we call them multi and interdisciplinary, whereby you liaise by almost every profession in the community. So as you're implementing a certain project in the community, we have also to get an accountability. Are we making profits? Are we making losses? Are we making shortages? We must give an accountability at the end of the project. Now we have acceptability. Acceptability of care demands on a variety of factors, including satisfactory communication between healthcare providers and the patients, whether the patients trust the care, and whether the patients believe in the confidentiality and privacy of information shared with the providers. Yes. Is the service which is being provided friendly to the community members? Is it within the line of their cultural norms, or it's violating their cultural norms? Is it acceptable by everyone in the community? Those are the questions that you need to ask. So, and remember, we say that it should be acceptable. We go back now to the definition of PHC. I say it must be accepted by everyone in the community. Whoever is in the project must accept the service. So if it's violating the rights and the rights and the cultural norms of the people, then it's not a good project. So those are the 8 A's. Now we are looking at the 3 C's. Under the 3 C's, we have competenciness. I come again. We have completeness. Completeness of care requires adequate attention to all aspects of a medical program, including prevention, early detection, diagnosis, treatment, follow-up measures, and rehabilitation. Then comprehensiveness. Comprehensiveness of care means care is provided for all types of health problems. Continuity of care requires that the management of a patient's care over time be coordinated among providers. Public health sciences. Whether the service is needed at all in relation to essential human needs, priorities, and policies. The service has to be properly selected and carried out by trained personnel in the proper way. A subheading: primary care is an approach that number 1. It focuses on the person, not the disease. Considers all determinants of health. Here we are saying primary health care approach. It focuses mostly on an individual, not the disease. And it considers all the determinants of what? Of health. Integrates care when there is more than one problem. It collaborates with the other services to provide the care, more especially when there is more than one problem. Another dot. Uses resources to narrow differences. It uses the resources which is available in a certain community to reduce differences. Another point, forms the basis for other levels of health systems. Another point, addresses most important problems in the community by providing preventive, curative, and rehabilitative services. Another point, organizes development of resources aiming at promoting and maintaining health. The PHC philosophy and strategy. Health for all is justified as a fundamental human right on the basis of equity and all economic and social development. PHC is not more machine for the poor, and it should not be considered to be mean a second class health service meant for raw population. It is an essential health services value for all countries, from the most to the least developed ones. In fact, it is particularly a burning necessity for developing countries. Therefore, PHC as a philosophy includes equity and justice. Another point, individual and community self-reliance, interrelationship of health and development. Here the philosophy of PHC now. There is equity and justice. As the resources are being distributed, as projects are being given to different communities, we must also enhance the element of fairness in the distribution of resources and services to the people. Is there fairness in the distribution of the services? Individual and community self-reliance. Is the service that is being provided making the individuals self-reliant? Are they being driven by other forces, or they are self-driven, they are self-motivated? So meaning that the individual and the community, they have to rely on each other. Not again the individual to go and rely on the experts. No. Meaning the resources has to be available within the local community. that even after the stakeholders have gone, the stakeholders have left, there is continuity of a project, there is continuity of the service. People will continue getting that particular service even after the departure of the implementers of the service. Interrelationship of health and development. There must be collaboration. The health and development sectors and partners, they have to come together to develop a platform that's going to help out the community members to address certain specific needs in the community. And this can be done by the health sector collaborating with the financial sector, the information sector collaborating with the agricultural sector, the health sector collaborating with the education sector. Changes in the health care system. The PHC strategy now. Now we are looking at now the changes in the health care system. And we are saying point number and total coverage with essential health care. Integrated system. Involvement of communities. Use and control of resources. Redistribution of existing resources. Reorientation of health manpower to PHC. Legislative changes. Health policy should address the need of the strategy of PHC, design, planning, and management of health system.